Hi, everyone. My name is Shua Chin, and my partners are Nicholas Kakuda and Rohan Datir, and this is our research on the prevalence of asthma and its associated factors in Asian American children living in California between 2011 and 2020. So as a quick background, asthma is a disease that results in swelling in the airways and can cause breathing difficulties, can be life-threatening, and is known to disproportionately affect minority groups. And numerous factors such as lifestyle, health insurance coverage, body mass index, urbanicity, and more are known to be associated with asthma. And there's limited research surrounding asthma prevalence and the strength of potential associated factors in disaggregated Asian American children.
Our research question is, what is the prevalence of asthma and its associated factors in Asian American children from California between 2011 and 2020? To answer this question, this investigation will measure the variables asthma prevalence, current asthma, asthma with medication, asthma with some sort of plan, asthma with diagnosis in the past 12 months, race, sex, body mass index, and insurance status. Specifically for teens, this investigation will also measure those who currently smoke cigarettes, those who have ever smoked cigarettes, the number of days of school each teen missed due to asthma, those who are confident they can manage their asthma, and those who eat at least 5 servings of fruit or veggies per day. To perform this investigation, we obtained data from the California Health Interview Survey for Asian American and non-Hispanic white children between the years 2011 and 2020. From there, we stratified all the examined covariates and produced graphs and charts.
So asthma prevalence overall is decreasing, but varies by race, with some races actually experiencing an increase in asthma prevalence. So within Asian Americans, Filipino Americans, and other Asian Americans have the greatest asthma prevalence, whereas Korean Americans and Southeast Asian Americans have the lowest. When we observe the analyzed covariates, we see that it is difficult to determine whether there is an association between asthma diagnosis and insurance coverage because of the limited sample of the uninsured. When looking at sex, we found that males tend to have a greater prevalence of asthma in comparison to females. The only exception to this was with South Asians. When looking at nativity, foreign-born Asian Americans tended to have a slightly higher asthma prevalence than US-born Asian Americans, but the difference was very small. So what are the implications of our findings? Well, because Filipino Americans and other Asian Americans tend to have the highest asthma prevalence, race-specific interventions for these populations may be quite promising. Because males tended to have more asthma than females, sex-specific asthma interventions in Asian Americans could be useful for tackling the sex disparity. So in addition, sex and race tend to be better predictors for asthma prevalence than nativity and socioeconomic status. Therefore, race-specific and sex-specific interventions may be more promising than income-focused or nativity-focused interventions. So if you'd like to learn more about our research or view our references, please be sure to scan the QR code on the bottom right of the poster. Thank you so much for listening to our presentation.